Alrighty, so I'm gonna go ahead and get started, and when new students come, it'll be fine, those filter in. So I'm just gonna go ahead and share my screen. Alrighty, so welcome to another installment of Vital's Digital Health Speaker Series. I'm Heenal, I'm the Director of Operations, and we're really excited to be hosting today's event in collaboration with our Husky Health Innovation Challenge, which is our case competition. So I will hand it off to Elisa, our Director of Special Events, to just talk very briefly about HHIC, and please stay until the end to hear a little bit more about the timeline as well as the upcoming workshops that they're going to be hosting.
Thanks, Heenal. So I think everyone here by now is definitely heard about HHIC and is familiar with us, but I highly encourage you all to check out our website at vitalhhic.org to sign up for this 1 to 2 week case competition and really just jump into kind of what an actual hands-on experience of approaching a problem in healthcare and taking into consideration all these different aspects of design and business would look like. So registration closes on March 10th, and I hope to see a lot of you there.
Awesome, thank you. So a little bit about us, if you are new to Vital, we are Northeastern's Healthcare Innovation Corps. As cheesy as it sounds, we aim to inspire, connect, and create. And we like to highlight that we're very interdisciplinary, and this extends to the case competition as well. You don't need to have any prior healthcare background to apply or feel like you're not going to do as well. It is very interdisciplinary, and we really hope that people from different fields come together to work on a project, and you do get to work with a group of people, either your choice or we put you together. So again, open to students of all backgrounds. So please do keep coming to our events or apply to our case comp. And our past events for this series have included wearable technology, mental health, and data and healthcare. And today we're going to be looking at solutions that span different age groups, which T, our moderator, will be talking about briefly right after this. And we also have upcoming events looking at the intersection of health tech and fintech, which if you're interested in finance and health and how they intersect, or think that that's really random and that they do intersect, then please come to that event. And we're also going to be hosting a student entrepreneur panel at the end of the semester. And this also includes an entrepreneur right here from Northeastern who has built his own startup and will be sharing the experience of that as well. And again, like always, our event recordings are on YouTube, and we also have articles on Medium about previous events as well. And today's event will also be recorded and put on our YouTube channel. But with that, I will hand it off to T, our moderator for today's event.
Hi, my name is T. I'm the outreach colleague of Vital. And so today's event, we will focus on how digital health implementation is across the age groups. And our conversation today will focus on how do existing digital health products help people across different ages. And today we are honored to bring in two awesome speakers, Dr. Gupta, the CEO and co-founder of Tempo Health, and Ms. Katie, the CEO and co-founder of Infinite Touch. So to kick off the event, I will let the two speakers to introduce a little bit about themselves, the background, and their innovation.
Katie, I'll let you go first.
Oh, I was going to say the same to you, Dr. Gupta. Well, it's nice to be here. Thank you for the invitation. I'm excited to talk about this. So my background is in special education with a kind of focus on autism. I started out as a special education teacher and then have kind of like varied my career around since then, serving as a therapist and coordinator of various different therapeutic programs. And about 7 years ago, we started InfiniTeach. And our focus with InfiniTeach was really to think about ways that we could use technology to create really effective and scalable solutions to reach the autism population and others with intellectual and developmental disabilities. And one of the reasons I think there's such a need for scale in this community is, I'm sure you're all aware, there's obviously been a huge increase in prevalence. And so I have a younger brother who's on the autism spectrum, which is kind of where my personal passion for this comes from. And when he was diagnosed 25 years ago, you know, the numbers were 1 in 2,500. today, the numbers are 1 in 54 kiddos are getting an autism diagnosis. And so you can just imagine that huge increase of prevalence, that resources and services just really can't keep up with such a growing demand. And so we are really turning towards technology to say, when you have a 3-year wait to access a healthcare specialist or a behavior therapist, what sorts of technology can kind of step in and fill some of those gaps. And so we've been working in that space for about the last 7 years.
Awesome. Hi, everyone. Good evening. My name is Anurag. You don't have to call me Dr. Gupta. I have a lengthy background, but I'm an emergency medicine trauma physician. But for the past 10 years, I've been focused very much on the informatics, innovation, and business side of healthcare. Spent a couple of years in Boston at HMS doing my postdoc in bioinformatics. Spent a couple of years as a director of innovation at Northwell Health, which is a large 25 hospital health system in Metro New York, where I launched their tele-ICU platform, which is now one of the largest tele-ICUs in the country. Also spent a couple of years at Boston Consulting Group, working on global healthcare strategy projects, mostly in the med tech space, and also a little bit of biotech and even less provider work. And then I ran operations for a radiology AI venture-backed startup called Imagen, and then launched Tembo about 3 years ago. At Tembo, our mission is to improve health outcomes for seniors, and we do that by improving access to hard-to-access specialties like psychiatry, cardiology, neurology, and so forth. And we're very data-driven, so we're measuring data in a meaningful way because our ultimate goal is really to improve outcomes, keep folks healthier, keep them out of the ER, out of the hospital, and frankly, keep them alive longer is really what we're aiming for.
Awesome. Thank you for your introduction. So our first question would be, what are some aspects of healthcare that are overlooked in certain population or age groups over others?
I can start with this one. Obviously, my background is not as specifically in healthcare, though we're starting to do a little bit of work around healthcare. And I think there's interesting disparities when it comes to looking at individuals with intellectual and developmental disabilities. We've obviously seen that in lots of kind of other areas, other communities as well. And I think the same is true with autism, right? Like access to care is a challenge, but it's often because of the delivery of the information. It's often because individuals with autism, have a higher susceptibility of kind of chronic healthcare conditions and kind of other underlying things. And I think part of that is that it is hard for them to access care because it's such a spectrum, right? It's a spectrum of intellectual abilities. It's a spectrum of needs. It's a spectrum of independence. And I think all of those things make it so make the care so multifaceted that it's challenging to maintain kind of a quality level of care. And I think one of the areas where we really see this in autism is with the adult population, because so often for kids with autism, we have a lot of services, we have a lot of catches for when we need to identify services that they need, not just healthcare services, but education and therapeutic services as well. And so until they graduate from high school or until age 22, they're kind of in this educational umbrella that provides a lot of those catches for them. But in the autism space, we often call age 22 the cliff, because that's when you transition away from education services and you go into adult services, and that same umbrella, that same, kind of guaranteed catch doesn't exist in adult services right now. And so that's when we really need to see a lot more self-advocacy and a lot more kind of caregiver involvement in a lot of cases. And I think all of those things are challenges to coordinating care for adults, especially adults on the autism spectrum.
Yeah, on the senior front, I mean, we only deal with seniors, and in our model of Tembo Health, we specifically partner with communities like nursing homes. We do that for a variety of reasons. It gives us more scale. It also allows us to leverage the infrastructure of the community, which includes the fact that they have electronic health records, so we can integrate with that to allow our physicians to have real-time access to all their medical history. But there's also nurses and social workers and primary care physicians who are all available at the nursing homes. And so our goal really is to help elevate the complexity and the quality of care that's provided to the patients in the nursing homes. And in so doing, it helps us overcome a lot of like barriers for seniors, because in general, accessing technology, internet, Wi-Fi, telemedicine, and so forth can be challenging for a lot of folks, but we're able to overcome that because in our model, we have we have some communities that are using iPads or laptops, we have others that have more sophisticated telemedicine carts. We try to be fairly device agnostic in that regard. But regardless, for the individual senior patient, it's pretty easy. It's almost like watching TV because a nurse or a social worker or one of the medical technicians in the building is going to facilitate all the technology. They're going to bring the iPad or the cart to the bedside for the patient. They're going to activate the device, connect on the video platform with the doctors. So now we've removed all those barriers. What we are finding is that Wi-Fi is becoming an issue. Pre-COVID, we actually prefer to set up a telemedicine room inside of a nursing home. We would install like a big screen TV and make it really nice environment. It is like very private as well. But now post-COVID, nobody wants to do that because it's very difficult to cleanse or disinfect a telemedicine room. So now everyone's going from room to room. But then we do face some Wi-Fi challenges with that because, as you can imagine, most nursing homes have not invested in that infrastructure.
Thank you so much for your sharing. So a follow-up question on that, do you see any generational divides in attitudes toward healthcare?
Yes, I mean, I think that there's, I'm not sure what the question is trying to get at. I mean, there's cultural divides, there's age divides, there's regional divides, literacy divides. I mean, so I'm not sure what you're looking for.
Just like a general idea, what are the generation gaps in viewing the healthcare system?
Yeah, I mean, I think what would be interesting is for me to share is and this is just my opinion, but in general, as you become older, you're going to pick up more chronic conditions, right? I mean, 90% of the people on this Zoom session are going to have hypertension, right? It's just a fact. Your arteries harden over time. We will all get hypertension. Most of us will have cholesterol. Many of us will have diabetes. 60% of us will get atrial fibrillation over time, right? So as you get older, you're going to get more chronic conditions. You're going to have more healthcare needs, more medications, more doctors. What I found is very interesting in terms of seniors and thinking about, the transition of care is that, when in your 50s, 60s, you'll start getting multiple medications, multiple doctors. And once you get old enough and sick enough that you need even more care on the clock where you end up in a nursing home, what dramatically happens is that you lose access to all your specialty doctors because specialists don't travel to nursing homes. You only get a primary care doctor. And so that's really why I started Tempo Health, was because this is literally what my experience was with my own grandfather. I grew up in rural Michigan, and at the age of 88, he finally needed to go to a nursing home. And it was a very difficult decision. In Southeast Asian cultures, we just don't do that. And I know a lot of other cultures that also don't do that. But he was having multiple hospitalizations, falling all the time. My parents worked. It was very unsafe for him to be at home. I actually considered moving in here with me, but it was also very difficult because my wife and I both work. So this wasn't an option. But what we found was that once he got to the nursing home, he went from having 6 doctors to 0 doctors because even his primary care doctor didn't travel to nursing homes. So what happened was with him, which is what happens with most patients moving to a nursing home, is that they get reassigned to a new primary care doctor, someone who already goes to that nursing home. and that's it. So he went from 6 to 0 to 1, and as you can imagine, that one doctor does not have the same competency and effectiveness as a team of 6 physicians, especially when you're talking about cardiology, neurology, endocrinology, and so forth. And so I was really blown away that this was kind of the status quo across the country. And so that's why I thought telemedicine was a great solution to provide access to all those specialties for our seniors, in particular in nursing homes. That doesn't really answer your question exactly, but I think hopefully it's relevant.
Yeah, it does. So Ms. Katie, can you share a little bit about what's your thought on that?
Okay, so it's making the discussion is making me think. We often talk about kind of the cliff in autism being younger, right, age 22, and so we don't see like adoption of technology being an issue or things like that. But I do think where we see a similar challenge in kind of the disability space is when it comes to insurers, in thinking about, when you have a child who also requires all of these specialty doctors and therapies and things like that, it's very easy for them to kind of stay on their parents' insurance and have access to all of those healthcare providers. And yet when they turn 22, or when they need to move into a residential program, the way residential programs are set up is that you need to have Medicaid in order to have a bed, a spot. There's not an affordable private pay option, and so immediately kind of you've switched the classification, the availability of the healthcare providers that you have access to. And so it's an interesting kind of similar parallel in that space that is a requirement of your living situation, that changes as a requirement of your living situation.
Thank you. So now we would like to dive in your innovation. So we have one question, what are some specific aspects of your company that you feel like you have to pay more attention to so that they will be user friendly for different age groups?
Happy to go first. We think about user experience all the time. And I think that's actually, from my experience, has been a huge failure in the health tech space at large, especially for telemedicine. We spend a lot of time really thinking about all of our stakeholders, and for what we're doing, it's quite complex because we have our physicians, we have the patient who's the resident in the nursing home, we have the frontline staff, which is like whether it's a nurse, a social worker, or a tech that's facilitating the visit. Then we have like the leadership of the nursing home, because they care about what we do and how we're doing it as well, because it reflects back on them. And then we have the family members of the patients as well, and then their primary care doctor. So actually like 6 different users or stakeholders, I should say. And we spend a lot of time really trying to think about how do we ensure closed loop communication, and that everyone involved in the experience, especially the doctor, the patient, and the caregiver, have a really nice experience, because nobody wants to deal with clunky technology or or just any frustrations, especially when you're trying to deliver healthcare. But anything's better than waiting in a waiting room for 4 hours, which I think is like the average for most people, especially when you're seeing a specialist.
That's interesting when I think about waiting for 4 hours with, again, my focus is going to be autism and intellectual and developmental disabilities. I mean, how would you do that? That's so challenging for anyone. and that's so when we kind of do projects in the healthcare space, we do a lot of different projects. We're basically like a niche development shop, and so we kind of find partners and we partner with them to create technology that specifically addresses and embeds best practice autism strategies into the technology. So those can be solutions in education or healthcare, community access, employment, kind of what have you. But when I think about healthcare, especially, we're, for example, we're working with Delta Dental right now to do a project to help kind of reduce pre-visit anxiety and increase kind of quality of oral healthcare at home. And so in creating that technology, we again are really thinking about how do we embed evidence-based strategies around autism into the technology itself. So that way, regardless of who's delivering the technology, the end user, the child or the adult with autism is going to get the benefit of those strategies. And so I think that's important. Thinking about content delivery is so critical when it comes to technology. That technology affords us this ability to change the look and feel and the content level of what we're delivering, like at the flip of a button. And why? So we should be using that all the time, because no single one of our users has the same needs, interests, cognitive abilities, all of that. And so how do we really capitalize on some of the benefits that technology affords us, I think is a really important question to ask yourself initially when you're thinking about this technology and what goal am I trying to accomplish, and then asking yourself that question kind of throughout the entire development process and beyond. Because you're going to come across users that just have different needs, different focuses, different interests, and creating a curated, kind of customized approach is, I think, really important.
Thank you. Your insights really helpful. So like a question regarding user. So has anything that surprised you about your user, like in observing how they interact with your product?
Yeah, so for us, I think one of the things that really surprised us was how much the caregiver seems to also benefit from our technology. So most of the projects we enter into, for example, the last few years pre-COVID, we were really focused on community accessibility. And so creating a technology platform that would help individuals with autism with like experiences. So whether that's going to a cultural institution or going to an airport or going to a library, all of those places that are required by the ADA to provide certain accommodations, but have no requirement and kind of no insight on how to provide accommodations for people with invisible disabilities. We worked with about 25 or 30 different partners across the US to develop this platform that would just make kind of community access easier for individuals with these invisible disabilities. And my number one takeaway from that was that while most of the 90% of the technology was created for the individual with the disability, the 10% that was created for the caregiver or for the family unit is as important, if not more important, because so often it is the caregiver that has, increased anxiety about whether it's going to a museum or going to a doctor's appointment. It's really the caregiver that also needs to know and understand that there are supports in place for them and their child, and that there are trained people and resources that they can access to kind of help make those visits more productive, more efficient, just better overall. So I think that was the big surprise takeaway from us, was how much we were instilling a sense of self-confidence in the caregiver as well.
Yeah, I think for us, like in terms of like user experience and so forth, one thing that's been really interesting is that about I don't know, towards the beginning of the pandemic, maybe 6, 7, 8 months ago, we really started encouraging family members to participate in all the telemedicine visits. And I think our current participation rate's around 70%, which is really high if you think about it. But I think it's the convenience. They don't have to take a day off of work to go travel to a doctor's office and sit in that 4-hour waiting room with their loved one, as a parent or grandparent or so forth. They can just click a link, secure link, and join the visit for 15 or 20 minutes and then be done with it. But what's been really interesting is it's actually allowed our doctors to get so much more information, because now the family members can, share additional information, concerns, questions. They can also help ensure that their family members are getting the follow-ups and follow-through that they need. And what's been really interesting is that we're now starting to get a lot of family members asking us if they can access Tembo Health as well. But we're sticking to our guns and trying to stay laser focused on, just partnering with senior communities.
So just a follow-up question on that. So so as you mentioned that COVID-19 has helped the user is more accessible to your products. So do you think that COVID-19 can negatively impact both of your company or your target health groups?
I mean, I think COVID is has its ups and downs. So at large, I think that there's been a societal shift in an acceptance of using telemedicine to receive healthcare. But I also think it's very similar to, you guys may be too young to remember the HHIC Act, 10 or 12 years ago, when the government provided hundreds of billions of dollars for doctors and hospitals to start using EHRs, right? So 15 years ago, everyone was on paper. 20 years ago, everyone was on paper, right? When you went to a hospital or a doctor's office. And what happened back then was that you had all this money, so you had hundreds of companies create EHRs, and doctors were just picking out of a hat, oh, you sound like a nice EHR. I'll buy this software and use it in my practice. What's happened is that 99% of those EHRs were very poorly functioning, and so forth, and most of them have gone out of business. But there's still many legacy EHRs that are just dwindling out there. It's just like, if you guys have seen the article, I think AOL still makes a few $1 million every month from people who are just paying the dial-up fee. They just never canceled the membership, and their credit cards just keep getting the bill and people keep paying it, which is really amazing. Maybe I'm dating myself with all these examples for this group. I had AOL dial-up at 14 kbps at one point. But I think the same thing's kind of happening with telemedicine. I think everyone says and thinks that, oh, telemedicine is benefiting so much from COVID because everyone wants telemedicine and so forth. But I think that it's created a lot of, unfortunately, not so great options. I think it's also further worsened, inequities in healthcare, because you have to have a computer, you have to have Zoom, you have to know how to use these things, you have to be able to coordinate with a medical practice that offers those things. Most public hospitals and so forth don't offer those things. It's harder to go to the ER hospital now because of COVID. So I think it's created a lot of problems at large. For us, we had fairly strong demand before COVID. Again, I think that the larger societal acceptance has helped us, move faster. But COVID's also created a lot of various bumps along the way. When there was the first wave, everyone was bunkered down trying to figure out, what is COVID? How do I deal with COVID? When the second wave came, same thing. A lot of nursing homes kind of just shut down. And then surprisingly, with the vaccine, it's just been a total cluster. I'm sure you guys are reading about the news every day. People are throwing away doses, people are being accosted and all kinds of things. People are cheating and skipping lines and so forth. But in nursing homes, they have virtually no capacity to operationalize massive vaccines, doses of vaccines. So they've really been struggling. And then on top of that, they have a lot of staff, frontline healthcare workers, that are refusing the vaccine for a variety of reasons. And so we've actually seen quite a bit of slowdown over the past 3 months with the vaccine. people are trying to figure out how to administer it.
Yeah, you know, for us, again, not being solely healthcare focused, COVID impacted our business model kind of from an entrepreneurial standpoint, where we used to license this kind of turnkey solution platform technology that we had, and it is hard to, when we think about building back better, it's hard to make people aware that universal design and access and inclusion needs to still stay at the forefront of people's minds, because really building back in lots of different industries could allow us to kind of think of access and inclusion for all as like a foundational principle upon which we should be building. But that is hard because you're competing with lots of other things. And so, you know, the one thing I will say, kind of the biggest impact we see on the autism community is that social piece. So autism is, you know, a disability that impacts social and behavioral so much. And so when you already maybe struggle with kind of developing and maintaining healthy relationships, and then obviously the consistency of your world that you were so used to is just kind of pulled out from underneath you, I think we really see a lot of regression when it comes to the social outlets, the friendships, you know, lots of those things that impact not only your mental health but your physical health as well. And so that's you know, for us, it's presented some new opportunities, new organizations that are looking to create virtual ways to kind of re-engage the autism community and things like that. Again, less from a healthcare perspective, but kind of just more broadly when you think about social emotional development and how that's really been impacted by COVID.
Thank you. So I have a question, like, what led you to opt for a digital health solution over some other medium for the specific issue in healthcare that your company is addressing?
So for us, it's like the best medium to really democratize the services that we're trying to provide. You know, the number one pain point for seniors receiving specialty care is, you know, they're old and frail and they're in a nursing home. So who's going to pick them up and drive them to the doctor's office? And then once they get there, you know, many of them find it very difficult to sit in the waiting room for hours on end. Whether it's physical issues, they may be in a wheelchair, have difficulty like walking, or they have dementia and like they just can't sit still like that in the waiting room without, you know, creating difficulties for everyone involved. On the flip side, you know, doctors are overwhelmed, they're busy, you know, they're working long and hard hours in the hospital and their clinics, and so like they just have no incentive to leave their filled waiting rooms to go to a nursing home and see patients, right? There's no incentive for that. But with telemedicine, it becomes much more convenient for everyone involved because it's virtual care. And whether you're seeing one patient or 10 patients in a nursing home, you can do it from the comfort of your clinic, your home office, or whatever. So I think it's pretty obvious there, but.
Yeah, I'd say it's, you know, I think I mentioned it at the beginning, kind of the scale and the need for increasing resources is really critical. But I think there's also, you know, a lot of research behind individuals with intellectual and developmental disabilities responding well to devices, to technology. It's, you know, so intuitive. It really removes a lot of the social element. So when I think back to my, you know, teaching days and teaching a variety of different students in special education, often what you would find is that the way you present information can really either help a student or really confuse a student. And that's one nice thing about technology, right? Like I'm kind of removing myself from being able to confuse an individual with autism. I'm removing this need to not only listen to what I'm saying, but also to read my facial expressions and my body language and my intonation. And so there's a lot kind of behind this idea that technology can be a great medium for teaching individuals with autism. So that was, I think, between the scale and kind of the research behind that, technology made an obvious was an obvious answer for us as well. But I think the concern for us is that we don't want skills, we don't want experiences to stay on technology. So unlike, you know, other kinds of platforms and apps where the end goal is staying on the technology, we typically try to make our end goal something in the real world, right? Something that allows our technology to serve as a bridge between needing to learn the skills in order to engage in this thing in the real world. So whether that's you know, going on a flight, being able to get through an airport without having a sensory overload or a meltdown or a behavior struggles, by first using the technology to teach you all about what that experience is, and then kind of be a resource and guide to help get you through that experience. Or whether it's, you know, similarly going to the dentist, right? And same thing, how do we use technology to educate, to help reduce some of that anxiety, to increase the skills that are needed for independence when you are actually kind of visiting the dentist. So I think using technology as a bridge rather than an end onto itself is really important for us.
Thank you so much for your sharing so far. I think now we're gonna open it to we open the conversation to the audience, and you guys feel free to unmute yourself and ask the speaker, or just drop it on the chat and then I can ask it for you.
It looks like we do have a question from Melissa in the chat. T, you want to read it out?
So the first question, so the question from Elisa, given the observed rise of anxiety with increased technology use, how have you designed your products to avoid them having a negative secondary effect among the people you create them for?
It's a really good question. As someone who does not use social media, rarely at all, I don't know this firsthand, but I know that there is, right, this rise. I talk to a lot of my friends who use TikTok, and I don't know if you all are TikTok users, but they often get the warning, right? That's like, hey, you've been on here too long, like get off TikTok. And I think for us, when we think about an autism population, setting expectations and having clear endpoints to ease transitions are incredibly important. And so when we develop, you know, games or schedules or anything like that, everything has a purpose and it has a clear ending. Unlike kind of mobile apps where you can just keep scrolling, you can compare yourself, you can, you know, whatever it is that is kind of causing that rise in anxiety. I think, you know, we really focus on the goal with our technology is really to support those transitions. Transitions for people with autism, switching from one activity to another, one topic of conversation to another, you know, one focus point to another can be really challenging. And so how do we help kind of build in those transition points into our technology? And I think that's one way that we really focus on this, not creating additional anxiety, but really helping with the preparation piece and the transition piece to help reduce the anxiety.
Yeah, as I mentioned earlier, having that caregiver help facilitate the telemedicine visit really helps reduce any anxiety around the technology and so forth. There's still some, and I think for a lot of folks, it's still difficult or painful to kind of try to have interactions over a screen. And that's why, again, our preference was to use a telemedicine room where we could have like a 70-inch monitor where the doctor's literally larger than life, and we had like speakers and microphones and all that kind of stuff built in to help with both the audio and the visual component. So it's a little bit tougher right now trying to do visits room to room.
Thank you. It sounds like there's another question in the chat.
Yes, I do have a question.
Okay.
Yeah, I have a question for both of our guest speakers. So this is like a two-part question. The first part is I'm wondering what needs to happen for your solutions to gain tractions and really make meaningful impact on the lives of those that you serve. And the second part of my question is about, so what would be the implications of these disruptions on physician and patient interactions and different treatment modalities that are available for those patients. Yeah.
Happy to start. So for us, like, we really think about the patient-doctor relationship and how do we preserve that. And so in our model, a patient will see the same doctor visit after visit. So it's longitudinal care, just like you would expect in any other setting. So if you're seeing one of our cardiologists, you will see the same cardiologist, whether it's every 3 months or every 6 months or every week. If you're sick for some reason, you all see the same doctor. And so, that really helps, especially with seniors and so forth. And what we're finding, interestingly, is that because of our platform, the way we've designed it and built it, especially thinking very mindfully about data and pulling a lot of data from the nursing home, EHR, but also from the staff and from the family and so forth, is that ultimately our doctors now have better access to patient data than they would if they were doing the visit live. So that actually allows them to make better decisions, better diagnoses, more comprehensive treatment plans and so forth. So we're really excited because I think, what we're seeing in our data is better outcomes. And, we've published some of those, but we have a lot more that we're hoping to publish later this year.
I think for us, I wish we were more in that spot. I wish we were a little more data-driven, outcome-driven. It's tricky because we have switched to more this project-based business model. And so we'll be the tech developer kind of behind a project, but then turn it back over to our client. And so we haven't figured out a great way to do research on a lot of our technology yet, but I think that is high on our list to really understand kind of the impact. We have, we get anecdotal reports, we get usage data, we get all of that, but I think what we really need is a third party to come in and say this is how and this is why. Kind of on the healthcare side, one barrier we often see is physician training and support staff training, right? So there are specific strategies that can be used to kind of support behavioral changes in individuals with autism and in or outpatient care. And I think that's an area where we would love to find a partner and really think about effective ways, not being from the healthcare space. I understand that time is not to be had in that space right now for physicians and staff. And so what are ways that we can still get kind of experiential learning with other learnings around these strategies to kind of really be able to be more involved in that space. So it's, again, we're so partner focused, partner driven. I think for us, a lot of it depends on finding the right partner.
Awesome. Thank you for your answers.
So there's one question from Shashank. He asked, have you found the need to pivot your products for those coming from different cultural backgrounds?
We haven't had to pivot. I mean, we're, in healthcare, you always have to be mindful of people coming from different cultures, different languages, and so forth. And so we've been pretty mindful of that from the beginning. And as we've grown in the South, we're looking more often at our clinician population to see how many of our clinicians speak Spanish, as an example, because that becomes more important in that region of the country.
Yeah, and kind of the impact of culture on autism is super interesting. One of my co-founders, that's what she did all of her research on, and obviously there's different levels of acceptance and awareness and all of that. I would say we also haven't really had to pivot, and again, I think it's because of our business model that we're so partner driven, right? That we're taking their content and kind of adapting it for this population rather than coming up with our own content in a lot of cases. And so it's really driven by what they have and what they need us to kind of adapt to reach this community.
Thank you. Another question from Alyssa. So what are some misconceptions about the population your products serve that you think should be debunked?
I can go. Yeah, so this is an interesting question. I think there's a lot of misconceptions around autism. You know, it's not necessarily a cognitive disability. So a lot of people with autism don't have a cognitive impairment. So one of the projects we just submitted for, hopefully we'll start to work on, is not healthcare focused, but employment focused. We partnered with Microsoft and Expedia Group to kind of analyze their entry-level technology positions and then develop training curriculum around that. That's again specific to people with autism and the way that they process information and learn best. And I think that misconception is so deeply ingrained in our society right now that people with disabilities, and especially autism, are often only put in low skill, low pay jobs, and that's not reflective of their capabilities. And so it's just a matter of tapping into their abilities and training, you know, providing training and support in a way that makes sense to them. And so I think, you know, we're super interested in looking at the employment space and thinking about entry-level technology positions specifically that are obviously really growing. So I'll stop there because again, it's not a healthcare example, but I think that there are, you know, misconceptions in the autism community or outside of the autism community kind of around things like that.
I think on the senior side, there's so many misconceptions. You know, I think unfortunately seniors are disregarded in many ways. But I think one of the more interesting ones that I learned about when I first started Tembo was use of technology. You know, I think in general people think that seniors are less interested in using technology. I think that's changed dramatically in the last 10 years. I remember even my grandfather at the age of 88, when he went into his nursing home, was you know, we got him an iPhone just because he wanted to FaceTime with my kids, you know, with his great grandkids. And he got really good at it, and it's, you know, because it was important to him. And when I would visit him at the nursing home, I would see that, you know, there are lots of folks there that were using some type of technology to connect with family and so forth. And again, this is like all pre-COVID. But I think, you know, that's just one misconception, but it's something that stuck out.
Awesome, thank you. I think we will take one more question and then we're gonna end the conversation today. Yeah, go ahead.
Yeah, I have a question. I was kind of wondering what was like the sort of indicator, like catalyst in your perspective fields to make you want to start your own company, make kind of a bigger impact instead of, you know, maintain your current position, because it's definitely a huge step. So I was just wondering what made you guys like take the initiative.
Yeah, I can go. So let's see, a good question. At the time that we started InfiniTeach, we had a separate nonprofit that was doing trainings internationally, primarily in Southeast Asia and Western Africa. And it was an all volunteer nonprofit. We would partner with a school in one of those areas, kind of do a needs assessment, and then pull together a group of volunteer professionals to go over and provide training. We'd do fundraising, we'd spend all the money on the trip, we'd come back, we'd have to do fundraising again. But we'd get back from these trips and our inboxes would just be flooded with hundreds of requests, hundreds of emails, you know, more information. And I connected you to so-and-so. And so obviously we knew that like we couldn't fundraise enough to like bring ourselves physically to all of these schools. And so we just said there's got to be a way that we can use technology. And then it was a little bit of a leap of faith. I think myself and my two co-founders were both, maybe older than a traditional postgraduate entrepreneur. We had families and things to consider, but it was a nice transition because we were all working as independent consultants at that point. And so it was easy to kind of wean off our caseload and build up our business as funding allowed for that, as kind of bootstrapping allowed for that. So there was a little bit of kind of like good fortune about the place where we were in our lives as well.
Yeah, for me, it was, I've always kind of been a tinkerer. This is actually my fourth startup. I had one successful and two failures previously. But in this particular space, it was really motivated by my grandfather's experience. It was just shitty to see him kind of go from 6 doctors to 0 doctors. While we thought he was going to get more care, better care, and yeah, he had great team of nurses and social workers and so forth there. But like, what you need is like medical care. The support staff can only be so impactful without the medical care. So that's kind of like why I got into the space.
Awesome, thanks guys.
Thank you so much for your sharing. Like they are super helpful, especially for us, like students who are really interested in digital health. So I would let Elisa to take over the rest of the event. Yeah.
Hi, yeah. So thank you again for speaking at this event. This has been really useful, and looking at these different populations and these different age considerations is actually going to be pretty relevant to our case and our case competition this year. So we hope that all the students who came will be able to take something away from it and use that in the case competition. So here we are working for a case competition with a number of sponsors, like we said, and also I forgot to mention in the first slide, but we are offering cash prizes for the first, second, and third place teams. So for a week or two of work, you could win more than $1,000 potentially of cash prizes, which is a pretty big deal, as well as have the opportunity to meet with some of these companies, get your resume sent and everything. So yeah, we're just really excited and honored to be working with these sponsors. And then today's workshop is Digital Health Throughout the Ages, and next week we're excited to be bringing in the Case Club from Northeastern, as well as a couple of people from Accenture to come in and discuss business concepts in the healthcare and public health spaces. So what those concepts look like in theory, and then what that looks like actually in the work that these Accenture consultants do. And then finally, after the case competition in April, we'll have another event. Yeah, so thanks again for your time. I'll be talking about HHIC up until registration closes, but again, I hope to see you all there, and thanks to our speakers.
Awesome. So yeah, just to reiterate, thank you again to both Dr. Gupta and Katie. We really appreciated you here and loved hearing more about your companies, as well as kind of the backgrounds of how you got to where you are and your solutions. Just as a quick reminder, I know Elisa just mentioned that we have some upcoming events with HHIC. In addition to that, more long-term, the dates are wrong on that, but we have a Leaders in Healthcare series instead of, it's not Meet the E-Board, it's Meet Sumit Nagpal. So we are not the CEOs and founders of Cherish Health, but that will be the second week of March, and then the third week of March, March 18th, we'll be meeting the E-Board. And then we have our Health Tech and FinTech event that I mentioned earlier at the end of the month. But yeah, thank you all so much for coming. And I know Dr. Gupta put something in the chat earlier about the different opportunities that are available through Tempo Health. And Katie, if there's anything that you'd like to share about InfiniTeach.
Well, thanks for having me. Mostly that. I appreciate it, and I'm inspired by what you all will be doing here in the future. So
awesome. Thank you both so much again, and thank you all for attending, and hopefully we'll see you next week.
Have a great night, everyone.
Thank you. Thanks, everyone. Have a good
Thank
night.
you guys.